McInerney from Croaky here, and we're at the APNA conference in Brisbane, and I'm talking to Meghan Campbell from Bega in New South Wales. Meghan, you've just done a really interesting presentation. Can you tell me what it was about?
So I presented on the Teen Clinic, which is an initiative we've been running in our practice at Bega Valley Medical Practice for the last 3 years. So it's a drop-in clinic for young people in our town, and they can drop in and chat to nurses about any issue they want. It's just a soft entry point for young people to healthcare.
And can you say how it came about? Because it was out of very traumatic circumstances, wasn't it?
Yeah, so about 3 years ago, I guess, we'd had a spate of youth suicides in our town, and we were literally sitting around the staff room going, what can we do? Why aren't these kids coming and getting help? What can we do to make the access easier for them to come and talk to health professionals? So that's how it started, really, the idea.
And what have you seen since then? What kind of numbers are you seeing, and in what way? And also, what kind of stories are you hearing that you wouldn't have heard before? This kind of thing.
So I guess initially when we started, everyone had concerns. Maybe we'll be overwhelmed. There was either that concern, or maybe we're not cool enough, they won't come. But it's been a process of just building up trust in the community and between us and the schools and the young people themselves, knowing that it's a safe place to go. They can come about anything, big or little. It's just become part of an option for them.
You said that confidentiality is a really big issue, particularly in regional areas, and obviously kids who come to doctors can end up sitting next to a relative or a neighbour or whatever. So how do you provide that safe space for them? What's different?
I guess a couple of things is we make sure that it doesn't have to be, it can be absolutely anything, so that if there's a young person sitting in the waiting room, they might be there for their sore toe, just like you're there for your blood pressure, whatever. So literally no stigma as to why they might come to Teen Clinic, which is really, really important in a rural town.
So it's not like turning up at the SDI clinic.
That's exactly right, yeah. Yeah.
And so how are you measuring success then?
It's a really hard one to measure success on because it's such an early intervention model, and it's such a group of people that we don't have a baseline to compare really, with our data, but we measure success by the fact that they're still coming, and pretty quickly word of mouth would get out if it was no good. So if young people are still coming and attending the clinic, we're happy with that. And it's because lots of funding needs proof of outcomes. It's really hard to prove how many pregnancies we might have prevented by access to contraception, or how many suicides might have been prevented, or how many major mental health illnesses may have been prevented by the fact that these young people were able to access really early intervention healthcare.
And that was interesting because the funding question, of course, came up because it's a nurse-led intervention, isn't it? So it's not, you're not getting a line item necessarily out of it. So how did it get supported by your clinic?
So the only way it became, it got off the ground at all was from the practice principal. Duncan McKinnon was happy to trial this and see how it worked, more for the benefit to the community, and he was happy to absorb the costs into the practice because he thought the potential benefit was so worthwhile. So that's how it got off the ground, and since then we've been building relationships in the community. So community groups like Rotary and Lions have supported us with some funding for things, but also then we had to look for grants. So we looked at APNA, Enhanced Nurse Clinic grants that we were lucky enough to receive 2 years ago. And then since then, our PHN coordinator has supported us with some rollout. But all of those are short-term solutions, and it would be such a shame for a model like this to sort of fall apart for the sake of such a thing as ongoing funding, which in actual fact is it's such an efficient model. There's really minimal downtime if nobody's attending, and the potential benefits to the community are huge. And I think it's a really efficient model efficient use of the Medicare dollar, if you like, or efficient use of health dollars, that it would be such a shame if we couldn't find a way to sustainably fund this type of model.
So what do you need? Who are you talking to?
Yeah, we would love some policy change that supported teen clinics in regional towns, teen clinic nurses in regional towns, so that teen clinic nurses were funded through training and then also funded to provide a teen clinic service.
And in fact, did you say there's been 4 new ones rolled out?
Yeah.
Just in the region?
Yes.
By different...
So 4 different practices in our region. We, through the innovation funding from our PHN, that's when we approached other practices with our model and asked if they would like to go in with us and apply for this innovation funding. And so 4 other general practices, all independent, were happy to take this on, knowing that it's really, really different way for general practice to think in about this type of access. Yeah.
Fantastic, Meghan. Thank you